Okay, so get this. Someone sent us this research paper,
Oh, yeah.
and it's called Ensuring Medical AI Safety. Explainable AI-driven detection and mitigation of spurious model behavior.
Catchy title.
Right. But it's about something pretty important, making sure the AI that's used in healthcare is actually making good decisions.
Yeah, and for the right reasons, too.
Exactly, for the right reasons.
That's a big deal. Huge deal. AI is being used already to diagnose diseases and plan treatments.
I know, it's crazy. It's amazing, but also kind of scary.
Right. But imagine if the AI that's making these decisions is getting fooled by something that doesn't even matter.
Like what? Give me an example.
Well, the paper talks about this thing called shortcut learning.
Okay.
And that's where the AI kind of gets fixated on a detail that's not actually important.
Uh-huh.
So, for example, like an AI looking at pictures of skin moles
Okay.
to figure out if they're cancerous or not.
Right.
It might see a Band-Aid on a mole and think, oh, it must be benign, because Band-Aids are usually used after you remove something benign.
So it's basically judging a mole by its Band-Aid.
Pretty much.
That's a little unsettling.
Exactly. That Band-Aid is what we call a spurious correlation.
Okay.
It just happens to show up in the data, but it doesn't actually mean anything about whether the mole is cancerous or not.
Right.
And you can imagine how devastating it would be if like a skin cancer diagnosis was missed.
Yeah.
Because the AI was focused on a harmless Band-Aid.
Okay, that's a bit scary.
Yeah.
But these AIs are so complex. How do we even know if they're like falling for these spurious correlations?
Yeah, that's where this idea of explainable AI or XAI comes in.
Okay.
It's like shining a light into the black box of the AI's decision-making process.
Wait, so we can actually see what the AI is focusing on? Like
Yeah.
we can peek inside its brain?
Pretty much.
That's wild.
Yeah.
So tell me more about how that works.
Well, one really cool tool that researchers are using are called concept activation vectors, or CAVs.
CAVs, that sounds very technical.
It is, but think of CAVs like a decoder ring for the AI. We can use them to represent a specific concept like Band-Aid,
Uh-huh.
and then see how much the AI is relying on that concept when it makes a decision.
I see.
So if the AI is lighting up every time it sees a Band-Aid, even when there isn't one,
Oh, wow.
then we know we have a problem.
So it's like we can see if the AI is obsessed with Band-Aids.
Yeah, basically.
That's really clever. How do researchers actually go about finding these spurious correlations?
Well, this paper suggests tackling it from two different angles.
Okay.
The data perspective and the model perspective.
Okay, let's start with the data perspective.
Yeah.
What's that all about?
So from the data perspective, researchers are analyzing how the AI responds to different data points.
Okay.
Remember those visualizations with like the clusters of data points?
Yeah.
So they're essentially looking for patterns in how the AI processes information to see if it's picking up on these spurious correlations.
Okay.
One of the techniques they use is called spectral relevance analysis, or SPRAY.
Spray.
Yeah, it's
Right.
a mouthful.
Yeah.
But what's really cool is that they can use it to analyze not only the visual input,
Right.
like creating those heat maps,
Mm-hmm.
but also what's happening inside the AI's thought process.
Oh, wow.
We call that the latent space.
The latent space, okay.
So by analyzing that latent space, they can see if the AI is making connections between things that shouldn't be connected.
So it's like they're analyzing its thought process across all the different examples it's seen.
Exactly.
That's really interesting.
And if something seems off, then they can dig deeper into the model itself.
Okay, so what happens when they take the model perspective?
The model perspective is all about getting under the hood and seeing how the AI is wired.
Okay.
Researchers want to see if certain parts of the AI are getting overly excited about those spurious features.
So it's like figuring out which part of its brain is misbehaving.
That's a great analogy.
Thanks.
There's this technique called DORA that's used to test which parts of the AI are getting distracted by irrelevant details. They essentially poke and prod individual neurons within the AI
Wow.
to see how they respond.
That's amazing.
It's fascinating stuff.
It is fascinating. So once researchers have identified these biases, how do they fix them?
Well, that's where bias mitigation comes in, and this is where it gets really interesting.
Bias mitigation.
Ah.
That sounds pretty intense.
It is. It's all about helping the AI unlearn those bad habits,
Yeah.
and focus on what actually matters medically.
Yeah.
The paper talks about techniques like right for the right reasons
Okay.
and class artifact compensation.
Wow, those are
Yep.
big names.
They use all that information from the CAVs and the other XAI tools
Right,
to
yes.
basically nudge the AI in the right direction.
It's like we're giving it a little extra training
Yeah,
to
exactly.
make sure it's actually making smart decisions.
Exactly. Sometimes that means retraining the whole AI,
Okay.
but sometimes you can actually just tweak it directly without retraining.
Oh, interesting.
It kind of depends on what kind of bias you're dealing with. But what's important is that we have the tools now to address these biases and make medical AI more reliable.
That's really good.
Yeah.
It sounds like the researchers behind this paper are really making strides in making sure medical AI is safe and accurate,
Yeah.
but focusing on these spurious correlations, that's just the first step in it.
Yeah, you got it. There's a lot more we need to consider when it comes to making sure medical AI is making fair and unbiased decisions for everyone.
Like what else is there?
Well, imagine an AI system that's supposed to diagnose a certain disease,
Okay.
but the data that was used to train it mostly came from people of a certain age group.
I see where you're going with this. So
Yeah.
the AI might not be as good at diagnosing people from other age groups?
Exactly. That's what we call demographic bias.
Okay.
The AI might overfit to the specific characteristics of the data it was trained on
Right.
and miss those subtle differences that are actually important for other people.
So it's not just about making sure the AI isn't distracted by Band-Aids.
Right.
It's about making sure it's fair and works equally well for everyone, no matter their background.
You nailed it. And that's why researchers are really focused on developing techniques to find and fix these demographic biases.
Okay.
One approach is to make sure that the training data is more diverse.
So it's like making sure it sees a wide range of patients during its training.
Exactly. It needs to learn from a diverse data set to be able to generalize to the real world,
Right.
where patients come from all walks of life.
Of course.
Another approach is to design the algorithms from the ground up
Okay.
to be more fair and unbiased.
So we're basically building safeguards into the AI
Yeah,
to prevent it from making biased decisions.
that's a good way to think about it.
Yeah.
And these safeguards can take many forms.
Okay.
Some techniques focus on adjusting how the AI draws its boundaries between different diagnoses
Uh-huh.
to make sure it's treating different groups equally.
Right.
Other techniques focus on tweaking the training process
Okay.
to lessen the impact of those sensitive attributes like age or race.
So it's like we're fine-tuning the training process to make it more fair.
Exactly.
Wow, this is all cutting-edge stuff.
Yeah.
But we've also got to consider how medical knowledge changes over time, right?
Yeah.
Like, how do we keep these systems up to date?
You've hit on another important type of bias. Temporal bias.
Temporal bias.
Think about how much medical knowledge changes over time.
Oh, yeah, all the time.
New treatments emerge. We learn more about diseases.
Right,
Diagnostic criteria evolve.
right. Medicine is constantly changing.
Exactly. And what we knew 5 years ago might be completely outdated today.
Completely.
Now imagine an AI system that was trained on data from 5 years ago.
Oh,
If that data doesn't reflect the latest medical knowledge, the AI's predictions might be outdated or even wrong.
wow. I hadn't thought about that.
Huh.
So the AI could be stuck in the past,
Yeah.
making diagnoses based on old information.
It's definitely a concern. That's why researchers are working on ways to keep these AI systems current
Correct.
with the latest medical advancements.
So it's like giving the AI continuing education.
You could think of it that way. One way is to regularly retrain the AI on new data.
Mm-hmm.
That includes the latest medical knowledge.
Okay.
This could mean adding new cases, updating existing labels, or even adding new information that wasn't available before.
So we're essentially making sure the AI keeps learning and evolving.
Right. We want to make sure it's a tool that helps us stay ahead of the curve,
Yeah.
not one that holds us back.
Right.
Another approach is to actually design AI systems that can learn and adapt as new information comes in.
Oh, wow. So these AIs are like little medical students, constantly learning and improving.
Exactly.
That's pretty cool. But even if we have all the right data and the AI is constantly being updated, couldn't there still be biases just hidden in the way information is collected or presented?
Absolutely. That's what we call presentation bias.
Presentation bias.
Hmm.
Okay, break it down for me. What is that?
It all comes down to the way patients describe their symptoms or even how doctors record information.
Okay.
Let's say we're training an AI to diagnose a specific condition
Hmm.
based on patient records.
Okay.
But those records might contain subtle biases based on how patients talk about their symptoms or how doctors choose to describe what they observe.
So even if the data is technically correct, the way it's presented could introduce bias.
Exactly.
Like if people from certain backgrounds are more likely to downplay their symptoms,
Right.
or if doctors are more likely to order certain tests for specific types of patients.
Exactly. Those biases can creep into the data and affect how the AI learns.
Wow.
This could lead to the AI making inaccurate predictions,
Right.
or even worse, making existing inequalities even wider.
It's like a domino effect.
Yeah,
Biases in the real world turn into biases in the data,
right.
which then get amplified by the AI.
Yeah, it's a big problem.
It sounds like we need to be thinking about bias at every level of healthcare.
You're absolutely right. It's not enough to just focus on the algorithms themselves. We
Right.
need to be mindful of potential biases in how we collect and document medical information,
Mhm.
how we train the AI systems, and how we interpret and use AI predictions.
So we need a holistic approach to make sure medical AI is truly beneficial for everyone.
Yes.
But with all these different types of bias, it can feel a little overwhelming.
Yeah.
Where do we even begin to tackle a problem this complex?
Hmm.
I mean, it feels like a pretty massive challenge.
It is, but you know, where there's a will, there's a way.
That's true.
And remember, this research is all still relatively new.
Yeah.
The field of medical AI is constantly evolving, and researchers are working really hard to develop new and better ways to detect and mitigate these biases.
That's good.
It's an ongoing process,
Yeah.
and that's a good thing.
It's encouraging to hear that there's so much effort going into making sure this technology is safe and equitable.
Yeah.
But it also makes me realize that AI is a tool.
Right.
And like any tool, it can be used for good or for bad.
Exactly.
It all comes down to how we choose to develop it and use it.
I completely agree, and that's why all this research on ensuring medical AI safety is so important.
Right.
It's about laying the groundwork for a future where AI can truly benefit everyone.
One thing that really stood out to me in all of this is the importance of explainability.
Yeah.
It seems like without those XAI tools like CAVs,
Right.
we'd be totally in the dark,
Yeah.
not really knowing why the AI is making the decisions it's making.
Explainability is absolutely crucial.
Yeah.
It allows us to understand the AI's reasoning,
Right.
to spot those potential biases,
Hmm.
and ultimately to trust these systems.
Exactly. It's not just about making accurate predictions. It's about making decisions that are understandable and justifiable.
Right, and that brings us back to the human factor.
Oh, yeah.
We can't just hand over healthcare decisions to AI without careful consideration and oversight.
Of course not.
Right.
So it's really about this collaboration.
Yeah,
Humans and AI working together to improve patient care.
that's the ideal scenario. And that collaboration needs to extend beyond just the doctor and the AI. We need researchers, clinicians, and even patients all working together, having these open conversations about the potential benefits and risks of AI in healthcare to make sure these systems are being developed and used in a way that benefits everyone.
So it's about making AI accessible and beneficial for all, not just a select few.
Precisely, and it requires all of us to be thoughtful, critical, and proactive in our approach to AI in healthcare.
This deep dive has certainly been eye-opening for me.
Good.
It's made me realize just how complex and nuanced this whole issue of medical AI is.
Yeah,
But it's also given me a lot of hope that by working together,
right.
being aware of potential biases and embracing this idea of explainability and collaboration,
Yeah.
we can harness the power of AI to really transform healthcare for the better.
I share that hope, and I'm excited to see how this field continues to evolve.
Yeah, it feels like we're just at the beginning of this incredible journey.
We are.
But for now, I think we've reached the end of our deep dive.
Yeah, okay.
Thank you so much for taking the time to share your insights with us.
It was my pleasure, and remember, knowledge is power.
Yes.
The more we understand about AI, the better equipped we'll be to use it responsibly and ethically.
Couldn't have said it better myself.
Yeah.
And to our listeners, thank you so much for joining us on this fascinating journey into the world of ensuring medical AI safety.
Yeah, thanks for listening.
We hope you learned something new and that you'll continue to engage in these important conversations about the future of AI in healthcare.
Until next time, stay curious.